An amendment to Statutory Instrument Number 62 of 2020 has made the wearing of masks mandatory. All persons, when leaving their homes, must adhere to the law, or they will be picked up by the police and charged for violating the state of emergency regulations during the COVID-19 situation. While many are complying, there are complaints of discomfort and difficulty breathing when using the protective face gear.
Yesterday, I was doing my regular workout and I had on this mask. I didn't want to take it off because I didn't want to get charged. But in the midst of that, I felt as if though I was going to pass out. And I had to take it off because I just felt that some research needs to be done on the use of this mask. I can understand why the police officers take off theirs. For you to be using this all day, it can't be healthy. I'm healthy, I don't have no kind of illness whatsoever, but I'm gonna be 60, so I'm at that high risk age, and I wouldn't want, after taking good care of myself, that I just drop dead because of a mask, you know. So not to, well, I may be exaggerating, but I just feel that eventually this is going to create some kind of problems for individuals, that they will come down with a different kind of ailment.
It is the basic process of inhalation. When you breathe in, the lungs bring oxygen into the body, and as you exhale, you are breathing out carbon dioxide, a waste gas produced by the cells of the body. So what about those persons who have pre-existing lung disease, such as asthma or pneumonia and tuberculosis, or even lung cancer? Their condition can be further complicated by the usage of masks.
When you inhale, when you exhale, more than likely you'll be inhaling back the same, a little bit of the carbon dioxide as you put it, and it will give you an adverse effect. If you do that too intense, too fast for a little while, your carbon dioxide will go up and you'll feel either dizzy or woozy and feel some unfortunate way. For those particular persons who have already a underlying lung disease, like the COPDs, the asthma, it's when they're in the public, it's the best thing to protect them actually, because they are a very highly vulnerable group. So they rather be discomforting, take it easy, than catch the virus. And because then when they're in a particular adverse situation, if they catch the COVID.
Now there are different types of face masks. Surgical masks are commonly used by frontline healthcare workers and are now retailing to the public at $2 a piece. Recently, several persons as well as some organizations have embarked on the mass production of reusable cloth masks, which allows for a one-time investment, especially during the economic crunch. Dr. Fernando Cuellar, an internist at the Belize Medical Associates, who has been very vocal about the local response to the COVID-19, says that he advocates for the use of masks.
These surgical masks are perhaps the better one to use overall, okay? They're designed to protect your airways better. They may be a little bit more expensive. I use both. I use the surgical masks here in the office, here in the hospital, because then I'm exposed to people who are sick, okay? But I also cloth masks that if I'm driving around, if I'm outside, I can use a cloth mask, okay? So those are the two different the differences between them. If I have, for example, I have right here what we call the more specialized mask, the N95 mask. If I have any suspected case, I switch from the surgical to that one will give me better protection. So that people don't need to be in the public with the N95 mask, just a face covering, okay, or the surgical mask.
As a result of the nationwide lockdown, the Young Women's Christian Association had closed off its programs. The organization is producing masks as a way of still providing a service to the community. At $5 each, the design of their cloth masks takes into consideration air quality and effective breathing while using the protective accessory at this time.
And I did a bit of research and realized cloth masks are recommended for the general public to use, not necessarily medical or surgical masks, but cloth masks, which is what we're producing. And you have to make sure that you have breathing space in your mask. So all of those clouds that are coming straight across, so it's across your face that suffocates you. Remember, you're going to be breathing back in your carbon dioxide. We breathe in oxygen, we breathe out CO2 or carbon dioxide. So when you have that air circulating in a tight space, you're breathing back what you're exhaling, which is very unhealthy. So you need to make sure that you have space within your mask to breathe, and the wide design does give you that.
In the Belize context, the response to COVID-19, despite 2 recorded deaths, have been good, and all positive patients have now recovered. There are warnings, however, that if Belizeans fail to be cautious, we can be hit with a second wave of the virus. Dr. Cuellar says that the obligatory wearing of masks is a sacrifice that must be taken regardless of discomfort.
Of course, it's a very inconvenient thing to have on, okay, especially prolonged, maybe an hour. Even us in the medical field who are used to face masks, now that we are using it 24 hours a day, 23 hours a day, 20 hours a day, we've also been affected. I can take off my mask right now and show you scars where it's drying up the skin on my face. And I don't like it, but it's necessary. I can understand the people who want to exercise and are being asked, for example, to use a face mask. Then you exercise at a less intensity, for example, or you choose to exercise indoors, sacrifice for at least another month, okay? But it is to the greater good of the Belizean public. If not, we are up the S-creek again, okay, without one paddle this time, if we were to have any second wave.
Duane, Moody for News 5.